So pain is also one of the vital sign, right? So vital sign must be assessed, or assessment is important to see the patient condition, we said. So when we have to check the vital sign, my friend, during the admission, as per doctor order, or with any change of health status. If your patient health status is changed, we have to check the vital sign. With the chest pain or any abnormal sensation, we have to check the patient vital sign, right? And also before and after administration of blood product or blood transfusion or medication that affect the cardiovascular or respiratory function, we have to check the vital sign. And also before and after any nursing intervention that affect the cardiovascular or respiratory system, we examine the patient vital sign. So vital sign include the temperature, heart rate, and the respiratory rate, blood pressure, and pain assessment. So right now we are just going to focus on pain assessment, right? So pain is also the most important one of the vital sign. So they said acute pain, chronic pain, or phantom pain. So acute pain. So if the pain is associated with any injury or medical condition or any kind of surgical procedure last hour to few days is called the acute pain. Chronic pain, usually associated for the long term or chronic illness, right, may continue for months to even years. It's called chronic pain. And phantom pain occur after the loss of body part like amputation. So when amputation occur means remove the limbs, amputation. Amputation may be felt in amputed part for year after the amputation, and it's called the phantom pain, right? So now go from data or data collection for the pain here. So when we measure the pain, we use a pain scale from 0 to 10. 0 means no pain and 10 means worse pain, severe pain. For a children or a client with a language barrier, we use the face pain scale, right? Face pain scale, we said. So when we have assessment the pain, we have to ask them what provoked the pain. I means what you do increase the pain, or what you do to reduce the pain. We ask the question. Even we ask what is the quality of pain, means the nature of pain. Is it sharp? Is it dull? Is it stabbing pain? I means nature of pain we have to ask. And what does the pain radiate? So what does the pain radiate? I said, does it move around, or what are the severity of pain? Means the scale from 1 to 10, or associated sign and symptom of pain such as diaphoresis or tachycardia or shortness of breath. And what was the time of onset, or is it constant pain or intermittent pain? So like here, data, pain is slightly individual experience, right? You do not see the pain. When patient explain, you has to listen or feel the patient pain. Ask the client to describe the pain, the degree, quality, or frequency. Ask the client about the use of complementary or alternative therapies. So sometimes when patient has pain, we try to motivate, or we try to divert their concentration to the others, like music, like subject change, like non-pharmacological measurement, like relax therapy or massage therapy. So it is called complementary medicine or alternative medicine to check the patient pain. Pain is experienced by older client may be manifested differently than pain experienced by members of other age group. Client with cognitive disorder, like the client with dementia or comatose client, may not be able to describe their pain experience because dementia or comatose, they do not talk. Or the nurse should be alert to non-verbal medication of pain. So now go more data collection about the pain. Ask the client to use a number-based pain scale, or we sometimes use the picture-based pain scale. So evaluate the client response to non-pharmacological intervention. Also consider the client culture in assigning the pain. Some culture, including many Asian culture, so they outward express of the pain. So sometimes pain is relieved to, if you request your patient change the posture. Sometimes I said pain relief when patient change their posture, or pain relief because of rest or relax technique, or if you give analgesia as per healthcare provider prescription, pain reduce, or offer some reassurance, allow the client to express their fear and concern, because pain also causes the anxiety. So distraction technique sometimes work to reduce the pain. So deep breathing, like imaginary technique, massage therapy, or eliminate the stimuli, they reduce the pain. So now go for a little bit more non-pharmacological management of pain. I said this is important, so I'm just going to give a focus on pain management here. This is called the non-pharmacological pain management. Here, one of the call is called cutaneous stimuli. Cutaneous stimuli. The other is called transcutaneous electrical nerve stimuli, shortly called TENS, transcutaneous electrical nerve stimuli and cutaneous stimuli. So cutaneous technique include heat, cold, or pressure, even vibration. So vibration can reduce the pain. Pressure, like acupuncture, reduce the pain. Heat therapy, cold therapy, or even hypnotizing technique also reduce the pain. So therapeutic touch or massage also cutaneous stimuli. So stimulation the nerve ending on the skin can be considered the complementary or alternative technique or medicine. So you do not give them any typical pharmaceutical agents or medication. In alternative way, reduce the pain, and this is called alternative medicine. A small electrical device sometimes we use to reduce the pain, and this is called transcutaneous electrical nerve stimuli. You must know, I said, NCLEX board sometimes say transcutaneous electrical nerve stimuli used for what? You have to know. Transcutaneous electrical nerve stimuli, shortly called TENS, used to refer as a percutaneous electrical nerve stimuli. This is the small device we use to reduce the pain. They stimulate the nerve ending. This technique, which is require the healthcare provider prescription, also involve the application of a battery operating device that deliver a slow electrical current to the skin, also underlying tissue to block the pain. And here we go, the pain continuation here. And management, like any kind of device we may use as prescribed the healthcare provider. Elevation of the affected body part is the another intervention that can reduce the swelling or supporting the extremity is a pillow may patient reduce the discomfort or patient feel good. Another conventional non-pharmacological technique like heat or cold application and also can reduce the pain. If you give ice or heat, right, ice or heat should be applied with a towel or other barrier between the pack and skin, but should not be left in the place for more than 10 to 30 seconds. I mean 15 to 30 seconds, right? So also we will not directly put to the skin here. And what are the other complementary or alternative therapies? So complementary alternative therapies are used in addition to conventional treatment to provide the healing resources and focus on mind-body connection. As a RN, what is our responsibilities in case of pain? So some of the complementary or alternative therapy sometimes require healthcare provider prescription. Herbal medicine or medication are considered pharmacological therapy by some of the healthcare provider. But always, if your patient take the herbal, we have to talk to the doctor because some of the herbal medication interact with other medicine, right? Especially the medication, what is the started by the letter G, they always interact with the blood thinner, right? So if your patient take heparin, warfarin, or coumadin, in the same time, if your patient take the herbal medication, that chance of develop interaction. I told if the medication started by G, herbal medication like ginseng or ginkgo biloba or ginger or garlic, they started by Z, the alphabet G. They always start with the interact with the blood thinner. Some of the herbal medication also not if patient take it, you have to tell to the avoid the sunlight, like St. John's wort or ginger, ginseng, right? Or feverfew, or licorice, clove. So I told if you see your patient take the herbal medication are considered the pharmacological, but you have to tell your patient, doctor or healthcare provider that your patient take it. So when doctor counseling them, at least you can evaluate any kind of risks. Non-opioid. So there are two type of pain medication. One is the opioid, other than non-opioid. Non-opioid do not have any chance of addiction or side effect, but the opioid, the chance of addiction or other side effect. Non-steroidal anti-inflammatory drugs, shortly called NSAID. So non-steroidal anti-inflammatory drugs and salicylic acid, other salicylic or aspirin, they are non-opioid. These medication types are contraindicated if the client has gastric irritation or ulcer, right? Develop the ulcer. So bleeding is a concern with the use of this medication. So you have to educate your patient. If they take the pain medication, always take after food, after meal, after lunch or dinner. So if the patient take this medication with empty stomach, the chance of gastric irritation or bleeding. Instruct the client to take oral dose with milk, right? Or any kind of food or snack to reduce gastric irritation. You must know for NCLEX board. And also NSAID or non-steroidal anti-inflammatory can amplify the effect of anticoagulant, can amplify. So anticoagulant activities will increase aspirin with warfarin, aspirin with heparin increase the coagulant bleeding time increase. Hypoglycemia may also result for the client taking ibuprofen. So ibuprofen is the pain medication, but they are non-steroidal anti-inflammatory. A high-risk toxicity exists if the client is taking ibuprofen, right? And here we go, the non-opioid continuation like acetaminophen. So acetaminophen is safe medication for the pain. Other name of acetaminophen is called Tylenol. So acetaminophen or Tylenol, basically we use for the fever, but they also use to reduce the pain. Acetaminophen is contraindicated if the patient has a liver disease or renal disease, or if patient has alcoholism, right? It's not too good to give them acetaminophen if they have hepatic problem, kidney problem, or alcoholic. Determined if the client has a history of liver dysfunction. So just check two enzyme is called SGOT or SGPT. So SGOT or SGPT, if hugely increase, indicate liver dysfunction like cirrhosis. Monitor the client for the sign of hepatic damage. How? Just see if patient complain of nausea, vomiting, or diarrhea, abdominal pain, fullness of the abdomen, because liver is a major organ of metabolism. If liver damage like cirrhosis or like hepatocellular carcinoma, right? So you've seen the picture. This is the healthy liver, and this is the chronic inflammation. This is the cirrhotic liver. So cirrhosis means nodule formation in the liver tissue, and liver tissue not functioning well, or carcinoma, liver does not work well. So if liver does not work, your metabolism will be shut down, right? So I said, just check a ST or a LT or SGOT or SGPT indicate liver damage, or alkaline phosphatates. Monitor the liver function parameter. So what I use, or I mean, this is the liver enzyme, and liver enzyme, it is the marker of liver. So this is the liver parameter like bilirubin level, alkaline phosphatates, SGALT or AST, or alkaline phosphate. This is the parameter. If liver does not work, your albumin level go down, your protein level go down too, right? So here we go, the next. So monitor the liver function and tell the client that self-medication should not continue longer than 10 days. Antidote to acetaminophen is called acetylcysteine, is the antidote. So the major concern with acetaminophen is a hepatotoxicity. Now go for opioid analgesic for the pain. Opioid is a highly addictive but very effective medication for the pain management. Example, morphine, pethidine, meperidine, heroin, caffeine, cocaine, all. So this medication suppress the pain impulses, but can also suppress the respiration. So if you prescribe or if you see your patient take the opioid, you have to check the respiratory rate because they causes respiratory failure. Opioid, which produce the euphoria or sedation. So patient feel good, they feel happy, euphoric, and sedative, and this causes the addiction and can cause physical dependency. Administer the medication 30 to 60 minutes before painful activities. Monitor the respiratory rate. If it is slower than 12 beats per minute in adult, we have to hold it and notify healthcare provider. Monitor the pulse rate. If patient is a bradycardia, means heartbeat is less than 60 beats per minute, we have to withhold and inform healthcare provider. Monitor the blood pressure for hypotension because opioid can cause hypotension. Also monitor, listen to the lungs for any kind of added breath sound, encouraging the activities such as deep breathing. Also, we have to tell them use incentive spirometer to help the pre-ventilate or pneumonia. So if you say your patient has to take the opioid for pain, you have to educate them before or after medication. Do not driving, do not do anything need to the alert, means factory work, heavy machinery dealings, right? So because this is dangerous is for them. So now go next here. So opioid, some opioid analgesia, monitor for the client the level of consciousness, right? Because opioid can sedation, their level of consciousness will be altered. Initiate the safety precursor, monitor intake and output, and check for urine retention. Also reinforce the instruction to the client who take the oral doses with milk or a snacks to reduce the gastric irritation. And also reinforce the instruction to the client to avoid activities that require the alertness and check the effectiveness of medication, right? The electronic infusion device, is always used for cutaneous or dose demand intravenous infusion to opioid analgesic. And here we go, opioid like codeine, right, or hydromorphine. So this is the to measure opioid. Sometimes we use morphine or hydromorphine or meperidine, right? Morphine, this is the opioid we use. So basic talk about the codeine. This medication is also used in low doses as a cough suppression. So if anybody take the codeine as a cough suppression, you can see they sleep a lot because sleeping or sedation is a side effect. It may cause, if patient take the opioid for a long time, it cause constipation. Common medication in these classes are hydrocodone, oxycodone, right? Hydromorphine is a type of morphine category. This is the primary concern in respiratory depression. So, what are the side effects of morphine or hydromorphine? They causes respiratory depression. Other effect including patient feel drowsiness, dizziness, orthostatic hypotension, or vital sign altered, especially respiratory rate. So easy way to remember the side effect of opioid is called A, B, C, D. A stand for altered the vital sign. B stand for they causes the respiratory depression or breathing depression. They cause blur of vision. Okay, and C stand for constipation. If anybody take the opioid, constipation develop. And D stand for dizziness, retention, distension of bladder, urinary retention. And here, last opioid in this page, morphine. Morphine sulfate is used to stoppage the acute pain, erase the acute pain, like myocardial infarction. So in case of myocardial infection, we use morphine, we use oxygen, we use nitroglycerin and aspirin. So major concern is the respiratory depression is the most common side effect of the patient who prescribed morphine. But postural hypotension and urine retention, constipation, pupillary constriction is also adverse effect of morphine. Morphine may cause nausea or vomiting. It is contraindicated in severe respiratory disorder. If your patient has a respiratory disorder, we have to tell not to take it because patient is die because of respiratory failure. Also monitor the client with urine retention or monitor the bowel sound for decrease the peristalsis or constipation may occur. Monitor the pupil for changes or pinpoint pupil may indicate the increase the overdose. So morphine is a medication for pain, but if you prescribe, we have to monitor for develop the side effect, right? So